Welcome to the Surrogacy Warrior podcast with your host, Kimberly Surratt. Join us as we dive deep into the heart of surrogacy, offering insights, sharing stories, and providing advice. Our mission is to illuminate every corner of surrogacy, from the emotional roller coasters and legal battles to the triumphant moments of birth and beyond. Surrogacy Warrior is more than just a podcast. It's a community for anyone touched by or interested in the transformative power of surrogacy. You can find this show on all the major platforms, including YouTube, LinkedIn, Facebook, Apple Podcasts, Spotify, and on our website, lawyersforfamilies.com. Now here's the host of Surrogacy Warrior, Kimberly Surratt.
Welcome, everybody. Welcome to Surrogacy Warrior, the podcast where we go through the journey together about navigating surrogacy and assisted reproduction in order to create families. I'm Kim Surratt. I am your host and your passionate legal advocate for creating families through these remarkable paths. Today, I've got two incredible guests with me, Jason Angel and Daddy Alex, which I love that that's your title today, Alex. But Jason's a daddy too, to be really clear. These two are fathers. They were intended fathers through a surrogacy journey. And I just kind of want to start out this podcast by saying, we will go into some negative stuff. We are talking about the things that went wrong or the things that we're not thrilled with. But please tell me, guys, there is positive to surrogacy, because I feel like sometimes I do these shows and all I'm doing is harping on all the negative. But is there joy at the end of it?
There is. As the intro stated, I mean, it's an emotional journey, but there, is joy at the end. And we have two beautiful 19-month-old twins to show for that journey. So there is positive.
Okay.
Yeah, absolutely positive. And, just 19-month-old twins and just echoing, playing bubbles with them and drawing with crayons and absolutely amazing to be with them.
So you two, tell us a little bit about your story. Tell us your background that led you to surrogacy and just kind of what that path looked like. We have some very specific goals today, I would say. The three of us have a journey that we're on with really seeking some justice and some equality in the insurance industry, and things that happen to you at the hospital that we want to talk about, maybe navigate around a little bit, and I can give some suggestions on. But tell us your background a little bit first, and let's go from there. And that way we show the happy side of the story, but also lead us into that path and that journey that was difficult and where your struggles were.
Yeah, Jay, I'm happy to start, and maybe you can fill in some details. But, I think once Jason and I decided we wanted to begin our journey to parenthood, it's not a very straightforward path for families like ours. And so it took a lot of investigating, and we were fortunate to have kind of a mentor of ours that had gone through the process and had told me, once you guys are ready, happy to hand over the baby folder of recommendations that they had. And that was really our launching pad for diving into everything that we needed. And when I think about our journey, it was a long journey. I think from our very first kickoff conversation with an agency to help us find a surrogate to babies in hand was a 3-year journey. Fall of 2019 to fall of 2022. So, with a lot of ups and downs and emotions in there. But I would say, as I think about our journey, I was thinking about this podcast and how to kind of explain what we've been through. I thought maybe there were kind of like 3 stages that we went through. 1 was kind of recruitment and building our team. 2 was the medical process, and 3 was pregnancy. And that's all leading up to the birth, right? Like this parenthood is a journey post that process, but it was quite a big process, to get there. So, we had to find the right team to help us. And, even your first question, I was thinking, some of the other highlights and really positives are the passionate people in the industry that, can help shine the light when, things aren't going well or you're confused. And we had a great team to support us. And we were really intent on finding the right folks that were right for our family. And so that's everyone from an agency to find you a surrogate, an egg donor, which IVF clinic we wanted to use. And, Jason and I were really quarterbacking that whole process to find those people. And of course, also a lawyer who's, operates within the space too. And then, we moved into the medical, stage with everything that goes into that, both on our side, the egg donor side, the surrogate side. There's a lot that goes on there. And then, the pregnancy kind of like third stage is kind of how I was thinking about our journey is a whole stage within itself. So that's kind of a high level. I'm happy to share more. If there's anything I missed, Jay, happy to let you chime in.
I mean, it is a full-time job. That's for sure. But a really, really wonderful journey at every stage. And I think so thankful on some level that we can in California in 2019 for us, we're able to go through this process to create a family. It's not everyone that can do that. And so it was a really wonderful and very complex process.
So as a full-time job, are the 18-month-old twins a greater job, more work, or was that work harder?
We get that question a lot.
You do know there's diapers and poop at the end of this journey, right?
Exactly.
You're gonna get there.
Yeah.
So, and I appreciate all the steps because I do think, a lot of people listen to these podcasts and are probably in your situation where you were when you began thinking, can I do this? Can I get there? You can get there. There are resources. And we talk again, I want us to talk about some of the things that happen to you that we want to prevent and some of the things we're advocating to prevent, to stop from happening to other people. But I like your stages. I think they help. It's create that team first, and there's a lot of members to that team. I would probably add in there. You had to deal with insurance too, because we are going to talk about that as part of your team. And the psychologist, and there's other professionals, but there's a lot of professionals. But usually, if you get kicked off on that first person, usually it'll lead you to the others. We may have to see if we can get the person who gave you the book to be a guest on the podcast at some point, because I think that's brilliant. More people need to do that for people and be there for other couples that want to go through this. Absolutely. Or single individuals too. Okay. So tell me, what were some of the frustrations of the journey?
So many.
Jason, you want to start?
Yeah. I think to a large, I would say there's just an overlay in addition to this being a lot of work and wonderful work, because we've got a wonderful outcome at the end. But I think there's a huge financial barrier and a huge financial piece to all of this that I think it's important for people to be aware of. And then I think, something that sort of came to us, sort of landed on our lap as we went through the process, was certainly what felt like some frustrations or discriminatory pieces to the puzzle, in terms of how insurance comes together, or how, our interactions at the hospital, even before we got to the hospital, interactions, in doctor's visits. So I think it's a very challenging process, that's not without sort of, unfortunately not perfectly molded for families like ours.
I don't think I've ever asked anybody this, but do you feel that discrimination was more geared towards the fact that you were using surrogacy, or was it geared towards being gay men, becoming parents together? As far as the treatment, like you talked about in doctor's offices and at the hospital, where do you think the root of some of that was?
Yeah, it's a good question. And I think a lot of acts like this, there can sometimes be something called a microaggression, which falls under some, I think into a category of somewhat undetectable, maybe like a paper cut size, slight, that you kind of experience. In one of those, I think I was certainly surprised. Our surrogate was based in California. Her care was in California, and was surprised at the doctors that would run the ultrasound scans and then give the pictures to our surrogate while we were in the room. And, I think it just speaks to, certainly in a heteronormative situation, that would maybe be the right path. But for us, we had a rock star surrogate who was very clear every time it happened. Oh, no, those are for the parents, and would guide the doctor to give those pictures to us. So, I sense that it's a little bit of both. I'm not sure how to operate, with a surrogate and intended parent in the room, and potentially, a gay piece in there too.
It's, it makes me think to myself, there's training that's needed, right? I mean, a lot of it's training. And surrogacy's come a long way. So I can tell you, boy, when I first started doing it 20 years ago, the complaints and the phone calls I had while people were physically at the hospital were tenfold what they are today. Because the hospitals didn't even have policies for surrogacy. And there are still a lot of hospitals in rural communities and in states where there's not a lot of surrogacy, that have not created policies. And so they were trying to use an adoption policy, which is completely not relevant, because you've got to give deference to the birth mother who hasn't signed a consent yet to terminate her parental rights, and it's her baby until otherwise. And so I think training is a huge part of it. And I think one of the key things I wanted to pull out of what you said, you said you were surprised. Is that you were surprised because California is so liberal and so forward thinking on surrogacy, that it was like that in California? Yeah.
Yep. So I can only imagine in a rural community in a red state, potentially, what that would look like if even in California we, experience a lack of education around families like ours.
The ultrasound example was a good one. Let's talk. We're going to leave the big elephant in the room to the end, which is we want to talk about the lien issue with Kaiser and insurance. We'll leave that towards the end because it's a big chunk. But I want to talk about other little microaggressions like that, because I think it's a good learning lesson. People that are listening to this podcast, I think it can make a big difference. I know, Jason, you asked me at one point, can we legislate against some of these things? I don't know how. That's legislating good behavior in people and humans. And one of the things I learned a long time ago when I first started doing legislative work was that, you can't legislate behavior. You have to have definitive rules, and they've got to be sound legal principles. And you also can't legislate for the few. You have to legislate for the masses. And so with those concepts in mind, it does limit you at times because you can't figure out a statute to draft to prevent them from trying to hand the ultrasound pictures to the surrogate, right? Is it bad behavior? Yes. Is it legislatively bad behavior? I wish I could figure out a way I could orchestrate that. But what are other things so that if, hospital staff are listening to this, anybody's listening, that maybe they'll learn from this? I know, Jason, you had mentioned to me at one point an issue regarding being able to be in the room during delivery and issues with the doctors. What was that story?
Yeah. I mean, I think I just want to back up for 1 second, that I think there's always there was a feeling of that this just isn't equal. And I think that, my hope or my thought is, it just felt different for us and unequal. And I think my ask, or in terms of legislatively, or if hospital staff are listening or doctors, is it would just be really meaningful to have it be equal or the same as a typical heterosexual couple. And so I think this came up for us in a number of different examples, from requesting funds before we even got to the hospital, even though we had insurance and our children had insurance and the surrogate had insurance. This came up, when it came to their births, where we were sort of warned on some level. It was up to the surgeon or obstetrician the day of whether we would be permitted to be in the room to see our children's births. Cause of actually really deep and great anxiety for us, as if there isn't enough to begin with when you're first-time parents, but just whether we could actually be in the hospital room to see our children's births, and then it came up in other ways, whether we had a room to attend to our children, to have skin-to-skin contact, which is recommended early on, and just a place to be with them. And there was a way that this is done for many couples, but it wasn't done for us. And so I think I always come back to, it just felt very unequal. It felt discriminatory.
I think just to piggyback on Jason's example, so there are two things that he brought up. One was that we had to get special permission and an exception made in order for both of us to be in the room when the twins were born.
And that was despite your carrier gave consent for you to be there. And so despite her consent, they were still giving you pushback, right?
So getting her written consent, she actually wrote a letter to our doctor that we brought to a visit. We had the doctor put in her chart that she has given explicit consent to allow us to be there. She was really advocating for us, to the doctor that she wanted us there. And so it was just really outside of their normal practice, and created a lot of like, oh, I'm not sure how to do this, or, I think we'll have to get a special exception. And so it's this extra bit that like, a heteronormative couple process, doesn't include. And there's these extra like exceptions.
Well, and I want to point out to you guys, there are a lot of heterosexual couples who are also doing surrogacy and are also experiencing the same problems.
Correct. Yeah.
So
sorry.
Families using,
yeah. Just really any family using a surrogate.
That's that surrogacy part of it. Yeah.
Yeah. Because, they weren't prepared that there would be potentially two parents in the room and a surrogate.
Right.
And so the fact that the numbers were 3 instead of 2, it felt like threw everyone for a loop, and we had to get special exception. And so we ultimately did that, but that was because we had a really great doctor who spent extra time to ensure that it was in our file and recorded and coordinated with the hospital to make sure they were aware of that. But I also want to point out, it was very interesting, his logic, which was we were very fortunate that we made every doctor's appointment that our surrogate had. And he said he was so impressed by that, which is why he wanted to make sure that we were there for their births, which on the one hand is great. I mean, I think he really acknowledged our commitment to our children in a way, that if we weren't able to carry them, that we really wanted to be there. And this was an important process for us. On the other hand, it felt sad to me because I think there are also intended parents out there who, because of work restrictions, because of continued added financial costs, like maybe wouldn't have been able to make every single doctor's appointment in order to get a doctor to make that exception for them. And so
they had to advocate for themselves strong enough. Yeah.
The other piece of this that I think was also interesting is, despite all of these extra hurdles that we went through, despite the documentation in the chart, despite our surrogate sort of signing off and saying we could be in the room, on the evening of just shortly before their births, there was still, and I just vividly remember this because in the hospital room, staff were saying you have to ask the surgeon or obstetrician whether they will permit you to be there. So even after all of these hurdles and jumping through all of this, at 8 p.m., shortly before the time of our kids' births, I was still sitting there wondering, like, I actually don't know if we can both go and see them being born. Um,
Which is insanity. For anybody looking at going into this journey, I want to make clear though, it is your surrogate's body. It is her own privacy. And I tell my intended parents all the time, you can manage to ruin your relationship with your surrogate through the pregnancy, where she doesn't want you in the room because you're going to stress her out. And so be nice to her, because she really should be the only one making a decision whether you're in that room or not, based on her own privacy and her own fear factor, right? Because I've seen intended parents go off the deep end and become complete crazy people. And I wouldn't want them in there either. They would completely make me so stressed I wouldn't be able to even think about delivering the children, right? So you can ruin that for yourselves. But once that decision is made and surrogate has consented and said you can be in there, the only other thing I can fathom that should ever be an excuse from a hospital is a complete emergency surgery in a way where like no one's allowed in there. They are just in emergency mode performing surgery. And at that point, even if I was delivering my own child, they're going to restrict certain people from the room because it's a surgical emergency, right? That is very different. But the craziness of getting permission from a doctor when permission's already been granted and there's no medical reason for restricting it is sad. Like you said, it's frustrating and sad and stress that you shouldn't have had to put up with. It's craziness.
And,
The other,
yeah, I mean, just to reiterate your point, I mean, the fact that we had such an amazing surrogate who really felt the same way we did about being there about the importance of us being there for the birth. And so I would suggest to anyone who's listening to the podcast, maybe at the beginning of their journey, there's so many steps and qualification calls to so many parts of the journey. And if you're trying to match with a surrogate, that might be a great question to ask, in an interview with a potential surrogate, how they feel about that. Or, you have to kind of talk about all sorts of scenarios way ahead of time, and so it might be a good point to come up, make sure you're a good match there too.
The extra hospital room too, I kind of wanted to touch on that for a second, and I'll let that slide away too. Again, you got an entire hospital full of patients actively delivering and no rooms left. That's one thing. If there's extra rooms, there's no excuse. There's hurdles we need to jump through with that. We need to deal with insurance, and are they charging for that second room, and what insurance gets charged for that second room, right? But anymore, we're seeing so many of these hospitals not having nurseries anymore. Everything's in room with the woman who delivered, and that's problematic for surrogacy versus where you could normally go to be with your child and hang out in the nursery, a regular nursery. But now they're limiting themselves to just NICUs, which I guess financially makes sense for a hospital. I can't really say in that industry what makes sense anymore. Nothing seems to make sense. It all looks irrational to me on the cost levels of doing things. But I can imagine that stress also. Now, there's good hospitals and bad hospitals, and we've never named your hospital in this podcast yet. But to be clear, there are hospitals that behave well on these topics, and there are physicians that behave well on these topics, and there are others that do not. And part of it's creating good policy in these hospitals. All right. So we talked about at the hospital. I know there was an issue, though. Jason, you had expressed a concern about you had to do a criminal background check. You mentioned it was before implantation, which I was surprised about, because I have a California license, and we do have that requirement for some courts for parentage actions, but I personally have not seen that happen on the front end before implantation, but it depends on who's requiring it. I would differentiate if your surrogate just wants to know that she's working with a decent person who will actually pay her and it hasn't been to jail for fraud and embezzling money, right? Then I don't think a background check's a bad idea of all people, right? Because it's not for being a parent. It's being done for the purpose of, should she work with you? should you enter into a year-long contract process with her that could be longer, that is really intimate or not, if she doesn't know who you are, right? But who required you to do the background check?
I think that it was post implantation. I think it was a part of the process to get the parental judgment
Okay, yeah.
from the court, if I'm remembering correctly.
Yeah, I think that's correct. Yeah.
Yeah, so not all courts in California are requiring that. And there has been a debate around the country about whether that should become part of legislation as to whether there should be a background check or not. Again, I personally, I don't understand it at the point where you have a surrogate who's pregnant with your children and about to deliver, and what you're going to decide no parentage. I guess if what they found in your criminal background check is that you're human traffickers and you've done this before and had a surrogate and took off and sold the baby, and now you're creating new ones to sell, maybe that's the issue, right? But I find it not useful if it's not done before she's pregnant, before the surrogate decides to work with you.
I think it felt a little odd. I mean, I'm not familiar with this scenario, but I think even if you don't have a clean background check and you were pregnant, you would still be given your child.
True, unless you're a pedophile.
Right.
Unless you're a pedophile, then you don't go home with your child. Unless you are, a felon with a child-based crime.
Yeah.
Right? So true-ish.
Yeah.
Right? Because believe me, I do abuse and neglect cases still. It's my pro bono work. It's the only regular other family law I do other than reproductive anymore. And I'm a hearing officer for them. And yeah, the things I see. So, yes and no. You're not going to go home with your child if you delivered on meth, right? And you've been in jail and different things. So, but I get the feelings. I understand the concept behind it, because anybody can get pregnant and not have to explain themselves necessarily. The days come, believe me. But I understand that feeling. And again, I think it's couched in how it's presented to you. This was, we're going to hold back your parentage when your surrogate's already pregnant and you've already spent how much money? I mean, that's ridiculous. Versus agencies having it as a policy of doing one just so that surrogates feel comfortable that the person they're matching with isn't a pedophile, right? Or isn't a criminal who's not going to ever pay them, because there's plenty of criminals. I had a guy that had a felony that was a single intended father, that was trying to leave another state, and he was trying to figure out how to get jurisdiction in Nevada because we don't do background checks. And he was leaving Utah. He lived in Utah where they required a background check. And when I really got down to it, I was like, okay, but what is your felony? I need what did you do? And it was child-based crimes. And I'm thinking, I am not working with you. No. And, again, it's just, we have plenty of surrogates whose intended parents don't necessarily pay all the bills. And that background check could be very telling to them. But there's a lot to be said about that, for whether a surrogate will work with you versus that other feeling, which is what you guys got of, oh, what, I have to do this in order to be a parent? Are you kidding me? What else? Let's see, Jason, I'm thinking through, you sent me a list of stuff. I know there was an issue with the birth certificate forms also in California.
Yeah, and actually, Kim, before we get there, I just wanted to mention that once our kids were born and healthy and wonderful, we fairly immediately, because we were there probably 24 hours, a total of 24 hours after they were born, we immediately got aggressive and intense calls from I think it was the finance department of the hospital, basically saying, in situations like these, we need money from you, essentially. Even though the kids had insurance, we had insurance, our surrogate had insurance. And it was, I think in 24 hours, I think we got a total of 9 calls. I mean, it was just intense and repeated. And and aggressive. And I think a place where um, it was just sort of alarming, and we didn't understand why that was the case. They just kept sort of saying, well, in situations like these, and that just didn't make sense to us. It felt like different treatment. So I actually had the thought at one point, were they, if we didn't give them this additional deposit, so to speak, were they going to not let us actually leave the hospital with our children? Unfortunately, we'd had one of our like members of our team who's wonderful, was Sarah Page from Art Risk, and we'd had a conversation, who deals with sort of the insurance piece of this, and she basically said, there's no reason why you would have to pay this. But I could imagine intended parents. I mean, it was a very aggressive stance on the part of the hospital. And I can imagine intended parents just saying, "I'm going to pay this," or having the similar fear to me of like,
got bullied enough into it till they finally collapsed and didn't have the resources, right, to know. Yeah.
And we had prepared for this conversation. We had very open lines of communication with our surrogate, and, we had talked to Sarah, and we had a sense that this would be a part of like our experience. And so, our line was like, push it through our insurance. We have insurance, like push it through insurance, and we'll pay any, bill that comes through the insurance, but we won't be doing a deposit. We won't be doing any prepayment. And even though we had talked about that, we told our surrogate that, she felt good, like everyone had the plan. I mean, it's such an emotional, vulnerable 24 hours. And, when someone's calling, being very aggressive about wanting thousands of dollars, it was distressing.
So everybody listening, I mean, hospitals will do this to you, period. I'll tell you that. It's not just surrogacy, but there was a reason with these guys, and we were about to talk about the lien issue, that they were particularly aggressive, I think. But anytime I've had anybody at the hospital, I've told them, make $100 payment and tell them, you can put me on a payment plan, $20 a month. I don't care. Go little. Guess what? They'll take it. And they'll start leaving you alone. It's quite impressive. But the tactics of our hospitals and the insurance system has become just gruesome. I mean, this is really good examples of, you got a lot of other added layers of stress, which is, am I actually walking out of this hospital with these babies that I didn't carry, that I'm praying everybody doesn't question me on, right? And we're going to be okay. And I shouldn't be having to worry about that. And the issue, I just wanted to real quickly bring up the birth forms issue, because you were saying there was a mother-father line, and then that was it. And which is ridiculous, because California issues birth certificates. They'll do parent-parent. You don't have to have mother-father. You can have father-father. I mean, there's a lot of variations and options, but we're seeing that a lot. Nevada, as an example, uses an online company called Vital Check, and I'm calling them out on this because I'm so angry at this company. They tell everybody that there is no option for ordering your birth certificates with parent-parent, and that mother-father is the only option. It is not. I worked my butt off to get that change done in Nevada with Vital Records, and it's not. It's just flat a lie. And so my advice with listening to you guys and talking through this is always question. Don't just take on face value what they're telling you. The face value of them telling you you need to pay when you really didn't. Face value of, is mother-father the only option for the birth certificate? No. Just question and push. And I think, I mean, you guys can correct me, but I think the biggest asset you had is you're both very strong advocates for yourselves, and you didn't put up with it. And
Yeah,
some people will.
I really want to applaud my husband, Jason. I mean, he just, he really excels in this area of questioning and pushing back, and being your own best advocate for what you or your family needs. And it's tough. It's a difficult thing to do, especially against institutions that you think are there to potentially help you. It served us well to push back. So just absolutely, question and advocate for yourself.
Well, in the short time I've gotten to know Jason, there is nothing about Jason that will stand down. So in that regard, Jason, tell us about the lien issue and what we're not standing down on anymore.
Yeah. I mean, I think there's this unusual, and I would call it discriminatory piece of when you have a surrogate in certain counties in certain states, and when you have children, despite buying the surrogate medical insurance. And I just want to sort of pause there. Our surrogate had, from the Obamacare ACA exchange, regular insurance that everybody else would buy. Hospitals and insurance companies will often say, essentially, you owe us extra, you owe us more, and this is them, I think, in a sort of squirrely way. We'll call it out. I'm not afraid to do that. Basically, not wanting to support surrogacy or the kind of the healthcare costs associated with it, and effectively double dipping, essentially saying they want to be paid for all the premiums and co-pays and all of that for the insurance, and then they want additional money, essentially, to be paid back. So it's really a double dip, and it's often to the tune of tens, if not hundreds of thousands of additional dollars. And it's just not how it works with other people. And this is with surrogacy. It's a discriminatory, different, unequal piece that I really, and I think all of us on this podcast, really want to change.
Alex, what kind of stress did that add to the process?
I think the hardest thing was the elongated sort of black cloud that followed after the birth. It's like, essentially, an ideal situation would be like, you have your children, you're able to be discharged, and you go home and you like start this journey of parenthood.
Of not sleeping and
yeah, right. Poopy and lots of difficult journey, but to go through that and still have this piece of, we potentially owe the insurance company thousands of more dollars, was just always sort of in the back of our mind, taking up space that I would hope shouldn't be there for any family that needs to use a surrogate, that you should have, that mental space for yourself or for your new child or children.
So everybody knows they will reference these as liens, but it's a reimbursement right that they're asking for. It's not a right. They don't have the right. It's a made up right that the insurance companies created and designed. And so they're not going after just you, they're going after the surrogate and her compensation. So your surrogate continued to shoulder this burden also after the birth, after doing everything she was supposed to do and help you with and had promised to do. And so while California is a hot spot for these reimbursement requests from the insurance companies, Oregon's become the new hot spot. And there are other states following suit, and with no real legal basis in them. But, with you guys here today, that the level of that is not just, I think I would go back to what we started with the podcast, which is the feeling of discrimination, the added stress levels that you shouldn't have had to go through, that you went through just to have your children. When you already had to go through a whole, surrogacy is not ever going to be just really, really, really simple. You're dealing with a third person who you're trying to get to know well enough to carry your babies for you, right? But that's enough. That should be enough stress. It's hard to keep that relationship or create it. And thank goodness, I mean, you guys have said it multiple times, but you had a rock star surrogate. But without that, you sure didn't have rock star insurance or health system.
Right. Well, I think, Kim, you had added insurance to our team earlier in the podcast when I said like who was on our team. And I to be honest, it didn't feel like insurance was on our side on our team. It was something when you talk about areas where we had a question or push back or dig into, I mean, we spent many, many hours doing that on the insurance front. And, like I said, we had some great people on our team. Sarah's come up. Like, she was someone who we really quickly realized would also question, think differently, give us some sound advice on how to handle these situations. And so my biggest advice to our friends that are going through this, or anyone listening to the podcast, it's to really find a trusted advisor who can give you the right legal and financial advice and how to handle these situations. I think we learned later on in the process, as we were trying to fight our lien, that we probably could have negotiated with a hospital of our choice that would have given us a room, that would have been more educated in families like ours, had we been connected with him earlier in the process rather than at the end trying to fight the lien. And at the time when we had to make a decision about which insurance carrier to go with, we sort of felt like we had to pick the best of the worst options available, which all included varying degrees of liens. There wasn't an option of a no lien plan for us. And so, I would just say, insurance was definitely an area where it causes a lot of stress and pushback. And the TLDR is like, find a good lawyer who can help you navigate that early on in the process.
Sarah was the one I was mentioning as part of your team.
Oh, gotcha. Yeah.
Companies.
Okay. Sure, yeah. Sarah has a strong place in our team. Absolutely.
Yeah, exactly. So Art Risk Solutions, to be clear, they're a broker. Their job is all assisted reproductive technology, insurance, and they aren't the insurance companies themselves. They're a broker, but boy, they're fighting the fight. They're fighting the good fight to try to help families. But like you said, most families are up against making a choice. Like, what did you say? You had to pick the best of the worst.
Best of the worst. Yep.
Yeah, unfortunately.
Yeah.
But you picked the best of the best surrogates you possibly could have picked. So, all right. Any other words of advice you guys want to give for the audience before we take off?
I think it's a wonderful process in the end of you get to have a baby or babies that, there's nothing more rewarding than that. And I think, but I would also say, just to Alex's point of really would encourage anyone to build a strong team around them and to slow down for just a moment and question. If your spidey sense is telling you something doesn't feel right, don't rush into anything. Slow down and question and talk to people about what's going on.
Alex, anything else?
That's great, Jay. Yeah, I would just say life is miraculous. We're really appreciative and fascinated by science and its ability to help us create a family, but also, and just want to emphasize, the surrogate community and the community of people that help families like ours, it would not be possible and without them. And they're absolutely, I don't know the whole story behind Surrogacy Warrior, but since learning about the podcast, our surrogate was a warrior, and we'll forever be grateful for her and her part in our story. So just really appreciate you, Kim, and the work that you're doing. And the last piece I'll say is just how important visibility is. I think we're seeing in media more families, that look like ours, more families, in the public eye using surrogates, and any way that families like ours can be out there and talked about and visible. I think visibility is really important. And I say that in the month of June of Pride Month. For us, it feels really important. We're proud of our family and proud of the work that you're doing, Kim. So thank you.
Thank you, Kim.
You got me teary-eyed and gave me goosebumps when you said your surrogate was absolutely a warrior. And I just, it just got me. It just really caught me because they are warriors. I mean, what they are doing for people is incredible. I was a terrible pregnant woman. I did not do that job very well for myself. And I had the ability to do it for myself. And so these women that are willing to do it for other people selflessly is, selflessly, it's amazing. And so I appreciate that. And the other comment I really appreciate and want to kind of cap off on is I tell my clients all the time, you might hate me for slowing you down, but I swear to you, it is my number one job is slowing intended parents down, because they come in full speed into my office saying everything's taken care of. And I'm like, well, is it really? Let me see. Let me make sure your agency really had all the pieces in place, because it kind of is my job. And so, and people come in as independents without agencies, and that takes even more time to slow them down, ask the questions, get it right. All right, you two, I so appreciate both of you. I appreciate your courage. It's not always easy to get on something like this and talk about your personal life. But like I said at the beginning, there was a happy ending. Are twins as much work as everybody says they are? Yeah.
It's the crazy we know. It's the crazy we know. So
it's the crazy
in a wonderful way.
In a wonderful way.
Yeah.
All right. Well, thank you for joining us on this episode of Surrogacy Warrior. I hope you found our discussion enlightening and empowering. If you enjoyed the show, please subscribe, rate, leave a review, like us anywhere you see us. Your feedback helps us determine what listeners want to listen to and what other guests we may bring and the best content possible. Stay connected with us on social media and visit our website at www.lawyersforfamilies.com for more resources and updates. Remember, you're not alone on this journey. Together, we are warriors. Until next time, stay strong and keep fighting for your dreams. You can do it, one foot in front of the other.
You've been tuning into the Surrogacy Warrior podcast with your host, Kimberly Surratt. You can find this show on all the major platforms, including YouTube, LinkedIn, Facebook, Apple Podcasts, Spotify, and on our website, lawyersforfamilies.com. Thank you for your positive reviews, comments, questions, and for sharing this show with others.